Good afternoon, everyone, and welcome to today's webinar, ASPHIO White Paper Highlighting the Vital Role of Public Health Inspectors. My name is Elena McIntyre. I'm currently the Manager of Toxicology and Exposure Assessment at Public Health Ontario, and I have the pleasure of moderating today's session. Today, I will be learning on the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabeg, Wendat, Huron, and Haudenosaunee Indigenous peoples, land that is today home to many diverse First Nations, Inuit, and Métis people. As someone who has devoted much of my life to environmental health, I am grateful for the environmental stewardship of Indigenous peoples who have protected and cared for these beautiful lands since time immemorial. Before we begin, I will mention a few housekeeping items. The chat pod has been disabled to limit any distractions during the presentation. Instead, please use the Q&A pod if you have questions. We do encourage you to type your questions throughout the seminar, but please know that we will be reserving time at the end to go through and answer them. The discussion and question period that will follow these presentations will allow our speakers and myself to make every effort to address as many questions as possible. If at any point during the session you experience technical issues, please email capacitybuilding@oahpp.ca. It's now my pleasure to introduce the speakers for today's presentation, Stacey LaForest and Peter Haywood. Stacey LaForest and Peter Haywood are the current chair and past chair, respectively, of the Association of Supervisors of Public Health Inspectors of Ontario, also known as ASPHIO. Peter and Stacey are both certified public health inspectors and both currently work as directors in local public health units. Peter, I'll now pass it to you to begin.
Thanks, Elena, and good morning, or good day, and good morning, good afternoon, everyone. My name is Peter Haywood. Really happy to be here to share the results of the white paper that was done in consultation with several people across Ontario. So before we begin, just a disclaimer, this presentation was created by its author. It was published on Public Health Ontario website for public use as outlined in our website terms of use. Public Health Ontario is not the owner of this content. Any application or use of the information in this document is the responsibility of the user. And Public Health Ontario assumes no liability resulting from any such application or use. So, well, how did this all start? Well, during our ASPHIO Fall AGM of 2022, it was the first time that we all got together face-to-face post-pandemic. And so there was a lot of energy and excitement in the room just to kind of reconnect with old colleagues that we haven't seen face-to-face for several years. It was during that particular ASPHIO AGM of November 2022 where we started talking about the role of public health inspectors in response to the pandemic and the value and importance they played in supporting health and well-being in the community. And so the COVID-19 pandemic highlighted the importance of the public health inspector workforce as being flexible and being able to quickly adapt to changing circumstances for new and emerging challenges. Public health inspectors exhibited the ability to learn and apply new knowledge and skills very quickly. As we noted, there was several different requirements prescribed by the Ministry of Health almost every week. And so it really required the public health inspectors to really quickly adapt and apply that new knowledge and skills in the community. The public health inspectors highlighted the ability to engage in interdisciplinary collaboration and coordination with the public health workforce. It is about working with a multitude of public health professionals within local public health agencies, as well as different community partners within the community. And they're able to work very closely and proactively with a wide range of community partners, informing them of the various roles and responsibilities as owners and operators, and also as partners who are trying to understand and gather more information about their role and function in responding to the pandemic within their respective agencies. And so all these qualities really demonstrated the value of public health inspectors. And also we talked about, how can we leverage this experience as part of the pandemic to help inform a healthy public health workforce within Ontario. And so really the objectives of this white paper were to examine the current status of the public health workforce for both full-time and part-time equivalents, and to identify the skills and non-traditional roles that public health inspectors played in the pandemic response. And then finally, to understand how the pandemic impacted routine programs and services delivered by public health inspectors. Before we move much forward into the content of the white paper, I do want to acknowledge the great work of the project team. As I mentioned, there was a tremendous amount of excitement within the ASPHIO AGM room that day, and there was excitement to move forward. And we recognized that it wasn't only just about moving forward in a coordinated fashion, but we had to move forward rather rapidly as well. In Ontario, there was a project called the Public Health Modernization Project, which is now called Public Health Strengthening. And we recognize that the value found within the white paper might help inform some of the public health strengthening activities that we're moving through currently. And so really the project team was multidisciplinary in focus. We were able to have many members of ASPHIO join to participate, including Jonathan and Virginia and Julie and Victoria. Canadian Institute of Public Health Inspector was our primary funder, so we certainly are very thankful for the funding from the Canadian Institute of Public Health Inspectors to fund this particular program, specifically the Ontario branch, and we're able to get the participation of John and Lisa throughout this project as well. Conestoga College, Kathy Egan was the co-chair of this particular project, and so tremendous kudos to her to helping support move this project forward, and there was tremendous support from Ken and Wendy as well. And we're also able to liaise with the Toronto Metropolitan University through Pat T, and his comments and feedback were invaluable throughout the process. And finally, the Ontario Public Health Association was instrumental in gathering all the information. So working on the qualitative data component, the quantitative data component, crafting the recommendations and the written report, and just having a lot of patience amongst all of us to go through the many drafts that we went through over a couple-month period there. So tremendous kudos to John and Sandy, who participated as the consultant from Public Health Ontario. And so the methodology was, we really wanted to reach out to ASPHIO members in all 34 health units. And we did that through both a qualitative lens as well as a quantitative lens. And how we did that was that we basically issued a survey that was constructed by Conestoga with feedback from the working group members. And that survey was sent to all 34 health units. And about 21 participated in fully answering the survey contents. And there was about 5 other health units who provided partial responses. The quantitative component of the research project was complemented through a qualitative report as well. And that's where we held focus groups. And so there were focus groups with ASPHIO members from across Ontario. And there was also a focus group with Sci-Fi members who were there to share their experiences and share their thoughts and opinions as it relates to their response during the pandemic. And some of the findings were really remarkable in terms of particularly the volume work completed by public health inspectors. And it was quite staggering. And one quote that really stuck out for all of us was, we were building the plane as the plane was taking off, and there was not enough hours in the day to catch up. And we found that to be a very profound quote that was captured during our qualitative session. The assessment and management of outbreaks in congregate settings saw a staggering increase of 7,992% from 2019 until 2022. And then outbreaks in long-term care homes for that same period increased by 257%. And that was reported by 22 local public health agencies. And there was also a real important human element as related to the findings of the white paper. In Ontario's report that there were 67 leaves of absence as reported by 20 local public health agencies, 24 retirements reported by 21 local public health agencies, and 61 resignations as reported by 21 local public health agencies. And so there was an extraordinary human impact to the pandemic as well that was told and shared through the white paper, through those qualitative sessions. And there was also an extraordinary human element that was displayed throughout the consultations during the focus groups. And I just want to share a little bit of some of their thoughts in words. So one person said, in our jobs, we listen and try to be compassionate. It was confrontational at times. People lost their shirts and you just had to listen and be compassionate. It was quite challenging listening to people crying about their business being lost. And that was, some of the things that public health inspectors faced in the communities that they served during the course of the pandemic, where they had to become active listeners and demonstrate a high degree of empathy and compassion. To demonstrate the versatility of public health inspectors, I just want to share a couple more quotes. I had many roles, from lead to supervisor at a vaccine clinic. I had the opportunity to showcase the skills of public health inspectors. During the training and experience and environments that public health inspectors are on a daily basis, and the skills and mindsets and response times and adaptability, public health inspectors successfully transition the pandemic work more smoothly than many others. And that just demonstrates the versatility of public health inspectors as they were asked to take on many different roles during the course of the pandemic, including in this particular case, being a supervisor at a vaccine clinic. Another quote said, often in a health unit, if something doesn't conform to a structure or a standard, it gets put to a public health inspector. I like to say if it doesn't fit, an inspector can usually figure out how to deal with it. But during the pandemic, that was taken to the next level because we had a versatile skill set, like being able to read the legislation and work through problems very quickly. And this was often demonstrated as well, particularly those public health inspectors who were sitting at call centers and where they were dealing with irate callers and they had to be transitioned quickly. And so often that particular call was shared with the public health inspector. So the aim of the recommendations is really intended to help public health inspectors are equipped to maintain the essential public health services and be prepared for any emerging issues and future emergencies as part of that larger multidisciplinary approach to public health. We also want to highlight in this white paper about leveraging the adaptability and versatility of public health inspectors by applying their core knowledge, skills, and abilities. There are many skills and abilities that public health inspectors share and demonstrate each and every day. Certainly the pandemic highlighted that, and they also highlighted new skills and abilities that Stacey will get into later. And then finally, we want to promote regular communication between ASPHIO and the Ministry of Health. We have a phenomenal relationship with the Ministry of Health. It's been ongoing for several years now, where we're able to have very good, robust conversations about public health workforce, about programs and services. And so we wanted to utilize this particular white paper to help form some of those future discussions as it relates to the public health workforce, as well as programs and services delivered by public health inspectors. Now it's my pleasure to pass it along to Stacey.
Thank you very much, Peter, and good afternoon, everyone. For my portion of the presentation, I'll review the recommendations from the white paper. ASPHIO's first recommendation for sufficient, stable, and sustained funding to Ontario Boards of Health is aligned with similar recommendations made in other recent and historic provincial reports. Since the white paper was released, additional details have been shared regarding the strategy to strengthen public health in Ontario, including the review of the Ontario Public Health Standards and a review of public health funding methodology for sustainability, increased and sustained funding for public health overall, with an adequate allotment towards a robust certified PHI workforce that is part of the larger multidisciplinary public health workforce in all local public health units across the province will help create a state of readiness for rapid response to public health issues and emergencies. ASPHIO recommends a collaborative approach with a range of partners to ensure sufficient, skilled, and resilient PHI workforce now and into the future through support and investments at every stage of the professional pipeline, beginning with a sufficient number of qualified graduates per year. This, combined with tuition support programs with return of service agreements focused on areas of the province experiencing recruitment and retention issues, would help to support students entering accredited post-secondary environmental health programs, while also addressing existing recruitment and retention challenges within local public health units. Ministry-funded practicum positions are an excellent investment in the public health system, and many public health units see candidates return for employment post-certification. ASPHIO recommends that the Ontario Ministry of Health and Boards of Health offer a sufficient number of practicum positions with a stable and adequate amount of funding to support these positions. ASPHIO further recommends investment in professional development opportunities for frontline PHIs, management, and senior management to support ongoing knowledge and skill development appropriate to each role. and to support specialized positions and succession planning. Key topic areas include those related to traditional environmental public health programs, as well as new and emerging areas such as climate change and infection prevention and control, but also in foundational public health work, such as the social determinants of health and health equity, and in areas of management and leadership development. As part of the Ontario Public Health Standards Review, we are encouraging that innovative and best practices from other provinces, territories, and countries be considered, and that technology be leveraged without sacrificing quality of programming or connections with local communities. As new performance indicators are created to align with the updated Ontario Public Health Standards, we are recommending that these be developed in consultation with the field and be a balance of meaningful outcome and process indicators that showcase the impact and volume of environmental public health programs and services as these align with ministry priorities. Further, it is our understanding that the Public Health Digital Platform Discovery Initiative will support consistent data collection, interpretation, and extraction for reporting of indicators and other key data. We note that a standard provincial data collection and reporting system would support efficiencies while reducing duplication. As Peter described and as highlighted in the white paper, PHIs played a crucial role in the success of Ontario's COVID-19 response and continue to demonstrate exceptional versatility and adaptability by applying their unique skills and core competencies to new and expanding program areas. Findings from this white paper demonstrate the vital role of a sufficient, skilled, and resilient PHI workforce in addressing current and future public health priorities. ASPHIO looks forward to working with the Ontario Ministry of Health, the Canadian Institute of Public Health Inspectors, and other partners with evidence, expertise, and guidance to help ensure the recovery, sustainability, and resilience of the PHI workforce and the public health system as we continue to protect the health, safety, and well-being of the communities we serve. We are now ready to go to the Q&A, and I'm passing back to Elena.
Wonderful. Thank you, Peter and Stacy. We will now move on to the Q&A segment of this event to address some of the questions from our audience. Please continue to enter your questions into the Q&A pod as we start to go through the first few questions, if you haven't already had an opportunity to. So the first question, were the metrics that were previously shared, things like resignations, LOAs, were they limited to public health inspectors, or did your survey also capture ones that might have happened with support staff or other staff within the health units?
Yeah, I can answer that question. Thank you for the question. Yeah, the statistics I shared as part of the presentation are limited to public health inspectors. That was the focus of the white paper, the role and function of public health inspectors delivering the programs in Ontario.
Fantastic. The next one is a comment, and perhaps you'll have your own comments for it. In the last couple of years, we've observed a decrease in the proficiency and professional quality of practicum students and newly certified PHIs. Are there any comments on that?
So with regards to that particular question or comment, we certainly work very closely with the Ministry of Health as well as the area schools as it relates to the competencies of students who are entering the profession as a student public health inspector, and we look at the learning objectives. We also, work with the Ministry of Health to look at how we can, promote and market additional interest in the role of a public health inspector across Ontario. And so I feel that public health units place a lot of value and perform a lot of great work mentoring and coaching student public health inspectors and preparing them for the board certification exam. So I'm not sure if I responded to the entirety of that particular comment. I'm not sure if Stacey has a few other thoughts as well.
Yeah, thank you very much, Peter. Very much echo everything that you noted. And I would only add, we do routinely in our current ASPHIO roles, do routinely meet with the Ministry of Health, as Peter had noted, and SciPhi Ontario branch, Ken Diplock, participates on those calls also. So there is ongoing discussions there, and we do connect routinely with the Board of Certification for SciPhi as well.
Wonderful, thank you. And this topic is a bit of a theme because we also have a question around this issue. Are there any specific measures to ensure that students and or new PHIs are performing at levels seen prior to the pandemic? And so is there any comparison there of kind of pre-COVID and then current performance?
It is. I can start off, Peter, with this one. This one touches much on the prior question as well. I would say that there's no performance indicators across public health units at this time, and I think that would be an interesting question to pose to the ASPHIO membership, perhaps. But it would really be a comparison within the respective health units or local public health agencies pre and post pandemic. It was noted, I can add as well, it was noted during part of the interview, so the qualitative piece of the research that we had done to inform the white paper findings, that some of the graduates who had entered the field during the pandemic really were limited to the work experience that was the focus of our public health work at that time, and in response directly to pandemic related matters. So there was some learning and some additional experiences that were needing to be supported as we emerged from the acute phase of the pandemic.
Thank you. Next, moving right along, the next question, was there any significant difference found between experiences in rural and remote health units versus urban centers during the pandemic? And then a second follow-up, do you think the recommendations you've made would be the same for, more rural remote health units versus these urban centers?
I can start that answer, Stacey, that's okay. So with regards to the differences between rural and urban, certainly it was highlighted in the white paper that rural or northern health units had more difficulty recruiting and retaining public health inspectors to help support the delivery of their programs and services. That observation is not uncommon, even pre-pandemic, in terms of the recruitment and retaining of public health inspectors. And so this is an item that we certainly share with the Ministry of Health in terms of how we can hopefully gain that interest to work in northern or central Ontario or in those rural areas, because the delivery of those programs and services are extremely important in those areas too. Do you have anything to add there, Stacey?
I don't have anything to add. Very well said. Thanks, Peter.
Okay, and I think this next one will be quite fast to answer, I believe. Are you aware of any similar survey that's been done across Canada, across our provinces and territories?
I am not aware. I'll see if Peter is aware of a similar survey. I'm not, however, and ASPHIO is the focus of the white paper because the association's focus is within Ontario, was focused on Ontario.
Yeah, I'm of the same. However, I will say there has been a couple reports related to burnout specifically. I think included a lot of different disciplines across Canada. So I don't have those reports on the top of my mind in terms of where they are, who wrote them at the moment, but I do remember seeing some surveys about burnout as well.
Thanks for that. And I expect many of us were probably participants in some of those surveys as well. Okay, next question. Do you believe the pandemic and PHI workload had an impact on low certification numbers from the October BOC, which I assume is Board of Certification, the exam?
Probably better to ask the Board of Certification directly, but I do recall that as with any certification board, there was some challenges in terms of how the certification would be applied during the pandemic, especially those first few months. And so, the board of certification did require some time to adapt to that situation, to offer that virtual option moving forward.
Thanks, Peter. I would add as well that from a local public health unit perspective, there may have been some capacity challenges during the course of the pandemic with supporting the same number of practicum positions as we normally would. Thanks.
Great. All right, next up, we do have quite a few questions coming in. In terms of capacity building for those who are already certified as public health inspectors, what kind of funding is there to assist those who want to upgrade their skills or acquire new skills to address emerging public health issues?
I could start that one. So I would say that Canadian Institute of Public Health Inspectors offers some very good professional development and training opportunities that can be accessed through the website and through the various listserv messages that you may receive. And so they recognize the value of ongoing training as well as professional development in terms of relationships and technical training around the programs and services. Funding within the respective local public health agencies, that's up to that particular team to inform how much they're allocated to the funding to help support the development of public health inspectors. But certainly SciPhi is a leader in that regard. And I will add to the continuing professional competency program, which is SciPhi oriented and is extremely important to participate in. And so, looking at the various technical discipline specific competencies that a public health inspector must build upon each and every year is also part of their role, self-guided, professional development training as well.
Okay, thank you. Do you have any recommendations on how PHIs can optimally leverage technology going forward? So a question specific to technology.
Yeah, I'm happy to start off with this one, Peter, if you're right with that. So I think that some natural examples that came out during the white paper interviews was kind of leveraging those technologies that we began using during the pandemic response. So because of the restrictions that were in place. So one example could be virtual confinement and releases of animals who have bitten an individual, provided that would be supported as an approach by the ministry, and also using new technology that has emerged since. So using AI, for example, to identify premises or geographic areas linked with potential foodborne outbreaks. Is there anything you wanted to add, Peter?
That's good.
Thank you. I apologize for the delay. I'm taking my own notes as we go through. Will there be follow-up research done to see how PHIs have responded and or adapted to returning to their normal workload post the pandemic?
We haven't talked about it as an ASPHIO executive, but we certainly see the value of the white paper and discussion that that is triggered and the interest from various parties. And so I think, as a responsibility of ASPHIO, we always need to consider what sort of information our members need to help inform decision making. So if that does require, additional research or projects or activities, then that's something we'll need to consider moving forward. At the moment, the answer is no.
Okay, thank you. As part of your review, we're utilizing retired public health inspectors for surge capacity discussed. And was a survey done to gather any information on how many health units might have brought back retired staff during the pandemic?
I can start off with that one, Peter. So that was not, it's a great question, a great point. And we had not included that within our questions to inform the white paper. I do know anecdotally, however, and very directly also, that there were, similar to many other professions, there were a number of retired PHIs who did come back to support the pandemic response.
Okay, thank you. Regarding the resignations of PHIs and the leaves that occurred during the pandemic, so the results that were captured during the survey, can you comment? Is there currently a shortage of PHIs in Ontario?
I can share that certainly in northern health units and in some rural health units. My understanding is that there does continue to be a number of vacancies amongst the PHI workforce.
And for the next one, what should be the focus for retaining PHIs now that we're in this post-COVID or post-pandemic era? Are there things that you think should be prioritized when it comes to trying to retain PHIs and that critical workforce?
Yeah, it's a very deep and thoughtful question there. I feel, just based on discussions with some of my colleagues across the province, there's this, time to recover, this need to recover from the trauma that was caused by the pandemic. And so it's about, offering that continued support throughout any organization to support that recovery aspect. Because trauma, takes time, it takes time to, work through and manage. And so just being, compassionate and empathetic, being an active listener, setting reasonable expectations as it relates to the completion of the work. I think those are all really important elements that we all need to consider in the delivery of our programs and services. Okay, anything to add there, Stacey?
I don't. Thank you.
Thank you. The next question is more specific to the methods that were used. And so why were the sample sizes of 14 to 19 persons chosen for focus groups?
Yeah, it's a good question. So, so that was the size, the range that was recommended by OPHA, who were the project consultants, so had facilitated those focus groups, and the real focus there was to support active discussion amongst focus group members. We wanted to ensure that the groups weren't too large. Thanks. Was there anything you wanted to add, Peter?
Okay, thank you. The next question. This goes back to, I believe, the fall oral exams for PHIs. Were passing rates for oral exams reviewed or compared as part of this study? Was anything like that considered?
No, that component was not considered as part of the study. And the board of certification, probably best to contact them directly as it relates to passing rates and fail rates.
That is a great point. Thank you. The next question is more about inter-PHU collaborations. And so in terms of mentorship and training, are there any examples that you could provide, or maybe some things that could be proposed to help, PHIs build new skills or, develop their current skills where health units could work together?
Sure. Yeah, I can start off with the response to this question. So, really great question, and something that was much discussed as part of our focus group sessions, but also more broadly at the ASPHIO in-person meeting. So acknowledging that there are different skill sets, different areas of content knowledge expertise within different health units, that also different capacities to support peer-to-peer training. So really thinking if the capacities were stretched within one health unit, and there was an individual who was seeking some peer-to-peer mentorship or training experiences, that they could really reach out to another health unit that they work closely with to provide that peer-to-peer training or mentorship. Thanks.
Thank you. Could you comment on the motivation and what drives PHIs to keep going? Any thoughts on how we can, I think retain PHIs moving forward?
Well, being a public health inspector is a great profession. I always say it's you're a Jack and Jill of all trades. You wear many hats, and so if you're a person who is driven by curiosity and motivated by the challenges in the community and in very different capacities, whether that be food safety, infection control, and rabies investigations, health hazard investigation. I think that's what motivates most public health inspectors and keeps them going as a PHI and to deliver that great type of customer service. So that's just more of a personal opinion, to be honest, rather than an opinion that was captured in the white paper. But it's all about serving the community. And, it's a very noble profession. You are a public servant, and if you see positive outcomes for your collaborations with community partners or with owners and operators of businesses, that just puts a lot of pride in the work that you do.
Thank you. So there's been a fair bit of discussion about, burnout and excessive workload and kind of the impact on public health and PHIs in particular. The next question is specific to practicum experiences. So do you think burnout, excessive workloads, work from home across our health units contributed to the quality of practicum experiences and training?
I would say that during the pandemic, so the focus of the ASPHIO white paper was really focusing on the period during the pandemic, and as we're just transitioning out of the acute phase. So I would anticipate the practicum experiences that were offered during the acute phase of the pandemic were very pandemic focused. I can't speak to the other items noted, but I would anticipate that practicums obtained during the acute phase of the pandemic were not the typical practicums that would be offered and had a very different focus. Is there anything you wanted to add, Peter?
Okay. So for the next one, first, a huge thank you to ASPHIO for leadership on this topic. And then our question goes, how are you able to speak to the present political climate in Ontario and the public's or business owners' belief in the importance of public health inspectors after the pandemic? And then a comment, I felt that we were often the ambassadors of bad news for small businesses, which may have stung our reputation in the long term.
I'm happy to start off, Peter. So thank you for the thank you. It was really an honor and a privilege to work with such a great team on drafting this white paper and inputs from many across the province. So in response to the question, I would say that it was noted as part of the white paper process that inspectors, supervisors noted the damages had been damaged. Some relationships had been damaged during the course of the pandemic, and that as PHIs returned to their normal programming as we emerged out of the acute phase, that it did take a time. It anticipated it would take additional time beyond that initial phase to rebuild those relationships and to get them back to a place, hopefully, where they were pre-pandemic. I agree with the reflections that we were often the bearers of bad news for many, including small business owners, operators. So really an acknowledgement that it would take some time to rebuild those. And also, it was noted within our white paper findings that there was an increase in non-compliance observed and additional re-inspections being required when PHIs were first re-entering premises that they hadn't attended regularly during the acute phase of the pandemic. So more time taken per inspection, as well as additional needs for re-inspection while they're also trying to rebuild those relationships.
Okay, thank you. What kind of provincial indicators might ASPHIO recommend in terms of assessing the effectiveness of the work of PHIs?
So this is an area that ASPHIO is currently focusing on with some of its committees and with the Ministry of Health. So we don't really have much of an update here in this regard, but we recognize the value and importance of it as relates to informing the annual service plan that needs to be completed by local public health units. Is there anything you want to add to that, Stacey?
I would only add that the indicators will be informed by the updates to the OPHS that are forthcoming, and that the field will be consulted as part of the update to the OPHS. We have definitely shared our interest with the ministry and with our colleagues there of actively participating on behalf of ASPHIO in those consultations, both for the OPHS as well as for the indicators. Thanks.
Great, thank you. This next question, it might actually come from an epidemiologist. Any correlation about pandemic stresses and leaves, LOA specifically, by age group or by age of public health inspector? Was there anything like that noted in your results?
We didn't note that correlation though.
Okay, thank you. Were the recommendations made in the report acknowledged by the Ministry of Health?
Yeah, so Stacey and I were able to meet with Dr. Moore and his team late last year, and we're able to share the contents of the white paper as well as the recommendations. We had an excellent discussion with Dr. Moore and his team about how to support the public health inspector workforce in Ontario moving forward, and there seemed to be a high level of energy attached to that particular conversation. That let's continue having these conversations and consider how we can move forward together, particularly in the lens of public health strengthening as we're all working together on the particular aspect.
Fantastic. This is a quick question, but you may not have the answer. Do you have information on how many practicums are actually available per year? Is there a standard number across the province?
There is not, no.
No. Okay, so it does vary. Currently, our Ontario health units finding staff are at or nearing burnout? And if so, what's currently done or what's currently being done to assist PHIs?
Yeah, I think that's left to each individual local public health unit and how they're supporting their staff and how they're addressing burnout and trauma and fatigue within their public health workforce. And so really the intent of the white paper was kind of to demonstrate provide a bit of a snapshot of what others may be experiencing so that it could be shared and to help inform some future lessons and practices within local public health units. But we don't have the data per se into what each health unit is doing to help support their staff. I know that many health units are completing after action reports to help kind of inform what those next steps may look like.
Okay, thank you. There seems to be a deficit in skills relating to prosecution efforts among PHIs. To ensure PHIs are best prepared for regulatory enforcement, has the ministry or ASPHIO considered deeper partnerships with the OPP College or other policing agencies that prepare investigators and or inspectors for law enforcement and court preparation?
I can start with responding to this question, Peter. So great, a really great point. I would say from my reflections, it's up to the local public health unit to ensure that the PHIs have these skills from a prosecution perspective if they are prosecuting internally, as well as from a progressive enforcement approach. The link with the OPP College is a really good suggestion and something that we can definitely share back as an option with our ASPHIO colleagues.
Okay, thank you. Prior to the pandemic, there were discussions about amalgamating health units in Ontario. And now that we're in a post-pandemic era, is that still expected to happen? And how will that impact issues like this one and PHI and the workforce?
Yeah, so currently in Ontario, there is a public health strengthening initiative that's being delivered by the Ministry of Health. And it's really three-pronged. One of the prongs does include voluntary mergers with local public health agencies in Ontario. And I think there have been several announcements by boards of health in Ontario related to the exploration of possible mergers. And then the other prongs include review of the Ontario Public Health Standards and the funding model.
Okay, thank you. And a follow-up, this is actually a second question, but it's related. With talks of health units merging in Ontario, was that considered in terms of effects on PHIs? And so was that at all part of the thought process going into the survey? Or do you have any comments on how it may affect the PHI workforce following mergers?
So certainly one of the intents of the white paper was to prepare for what we knew to be public health modernization at the time, and has since transformed into public health strengthening. So that was one of the purposes of the paper, is to help inform what public health strengthening looks like in Ontario. But with regards to the direct question, no, we didn't move forward with those aspects at the moment.
Wonderful. Okay. With that, I will say we have 2 questions remaining, and so we are getting through that lengthy list of questions. If anyone online has not posted their question, please do so now, as we're about 13 minutes away from the hour. And for the next question, and this one I believe is a follow-up to the earlier question around rural and remote health units, those operating heavily in the north. Are PHIs leaving those health units or leaving Ontario entirely to pursue jobs in other provinces? Do you have a sense?
I don't. I'll see if Peter has some additional information to inform this response, but I do know that there does continue to be vacancies, PHI vacancies within particularly northern and remote public health unit or rural public health units. I'm not sure if individuals are moving out of province to work, or if they're moving into the private sector or another sector. I can't respond to that piece.
Okay, thank you. So the last question, have you noticed if work from home accommodations and or flexible work arrangements in many health units have continued post-pandemic? And then a follow-up, have you noticed if this is something PHIs want or prefer?
Yeah, so I think it is something that has continued post-pandemic, especially as it relates to flexible work arrangements. That is certainly something that employers look at in continuous basis to provide that work-life harmony. With regards to the second question, have you noticed this something PHIs want or don't want? That part I'm not sure of. We haven't explored that as part of the white paper, and I haven't really conversed with many colleagues with regards to that either.
Okay, thank you. And finally, just as we close, this is not a question, but a comment from a public health inspector in Alberta who just wants to share that this was a very interesting presentation and question period to listen and learn from. COVID was definitely a challenge across the country, and kind of wishing that Alberta had done a similar survey. And again, thank you for sharing. With that, we are now at the end of our questions. And so as we wrap up today's webinar, I would like to again thank Peter and Stacy for presenting. I would also like to thank everyone who joined us for today's seminar, especially those of you who entered questions and comments. It was really great to have such a long thorough Q&A. We don't usually get to do that. Usually we're rushing to close off our seminars or webinars. You can expect to receive a brief and anonymous webinar survey for today's session. Please try to complete this. It does help us improve our programming here at PHO. Also, a reminder to everyone, the Ontario Public Health Convention will be held on March 26th and April 3rd this year. Please check topic.ca for details and to register. Lastly, to access past PHO presentations and to view confirmed and upcoming sessions, please visit the PHO website, head to Education, and then click on Events to see our presentations. With that, thank you all and have a wonderful afternoon.